Complications during a pregnancy can result in a delivery by cesarean. Typically, any subsequent births are also cesarean. Now, there are more women giving birth vaginally after cesareans. To find out who are the best candidates, we spoke with Dr. Rasha Hashad of Mission Hospital in Mission Viejo.
Women who are candidates for a trial for a vaginal birth after cesarean section include women who have had one previous low transverse cesarean section, a woman who has a clinically adequate pelvis, meaning that physician feels that the baby will fit through the birth canal, a woman who has never had a uterine rupture or previous transfundal surgery, and a woman who delivers in a facility in which an emergent cesarean section can be performed, which means that there is an obstetrician there available 24 hours during the labor process, anesthesiologist, and a pediatrician. Women who are not candidates for a trial of labor after a cesarean section include women who have had 2 previous cesarean sections with no successful vaginal birth, a woman who's had a classical cesarean section or T-shaped uterine incision or any other fundal uterine surgery, a woman who does not have a clinically adequate pelvis, or a woman who is delivering in a hospital in which there is not an obstetrician available throughout the labor, or that an emergent cesarean section cannot be performed immediately. Obviously, a woman must meet the criteria for no other contraindications for obstetrical or fetal conditions. The benefits of vaginal birth after cesarean section include a shorter hospital stay, shorter recovery time, and decreased incidence of blood loss and infection. It generally is considered safer for the mother. The risks of a vaginal birth after cesarean section include, for the mother, the risk of uterine rupture, which can include extreme blood loss, blood clotting problems, and even hysterectomy. In the event of a rupture, there can be a 50% risk of infant mortality or permanent neurologic damage in those babies. Once again, you have to remember that that risk is less than 1%, but when it happens, it's quite catastrophic. There are no absolute indications for induction of labor. There can be maternal reasons and there can be fetal reasons. Reasons can include such medical conditions as heart conditions, hypertension, diabetes. There can also include reasons for the safety of the fetus, in which it would be safer for the fetus to be outside the womb than inside the womb, such as growth restriction or low fluid. But whenever you do an induction for an elective reason where there's no medical indication, you want to be very sure that you have accurate dates and that you don't induce before the 39th week because of baby's lung maturity. There are several reasons why you may not want to do an induction on a woman, and the main ones are placenta previa, in which the placenta is blocking the cervix and therefore the baby cannot be delivered safely vaginally. If there's an abnormal presentation of the baby, such as a transverse lie in which the head is not down, or that the cord is in front of the baby's head, these are all reasons where one would want to avoid an induction.